Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan, and I want to talk a little bit about what can be done to minimize one's chance of getting the flu or the new coronavirus. We just downloaded some material today from the World Health Organization, so let me read this to you. I don't want to make any mistakes. I want to make sure this message comes across clearly. But before I even do this, the key here is, yes, be aware, but don't be alarmed. And I think with that attitude, if you follow the following procedures, I think this is really all that you can do and minimize any chance of getting not only the coronavirus, but flu as well. So wash your hands frequently, regularly, and thoroughly. Clean your hands with an alcohol-based hand rub, or wash them with soap and water, which I think, from what I've read, is even more effective than the alcohol-based rub. Maintain at least 1 meter or 3 feet distance between yourself and anyone who's coughing or sneezing. Avoid touching eyes, nose, and mouth. Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer those viruses to your eyes, to your nose, or mouth. From there, the virus can enter your body and make you sick. Practice respiratory hygiene. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue, of course. If you have fever, cough, and difficulty breathing, seek medical care early. Stay home if you feel unwell. If you have a fever, cough, and difficulty breathing, seek medical attention and call in advance. Follow the directions of your local health authority. Stay informed and follow advice given by your healthcare provider. Stay informed on the latest developments about the new coronavirus, the novel coronavirus, or COVID-19, as it's technically known. Follow advice given by your healthcare provider and your national and local public health authority or your employer on how to protect yourself and others from the coronavirus. When to wear a mask. Now, masks are in short supply. We know that because we use them here all the time. But if you are healthy, you only need to wear a mask if you are taking care of a person suspected with the coronavirus infection. Wear a mask if you're coughing or if you're sneezing. Masks are effective only when used in combination with frequent hand cleaning with alcohol-based hand rub or soap and water. Soap and water, washing your hands, from what I've heard, seen, read, is the most effective thing of all the things I'm talking about that you can do, and then keep those hands away from your face. If you wear a mask, then you must know how to use it and dispose of it properly. Now, for the average person, they're saying masks are really not the answer. Those masks, because there is a shortage of them, should be used for people who are sick or who are infected so that they don't spread that to other people, and for healthcare workers who are taking care of people who may be infected. So masks, hey, that's not the answer. These other things are much more important, particularly the hand washing. So be careful, be aware. I don't think there's cause for alarm. Actually, I think from what I'm getting to see, I don't think this is any worse than the seasonal flu, which sometimes can be severe and sometimes mild. And this is yet to shake out. I'm sure there are going to be more cases popping up throughout the country and throughout the world. It's going to run its course. Eventually, we will probably have a vaccine or a treatment for it. But in the meantime, make sure you take proper precautions and make sure your mouth is healthy. Because if your mouth is healthy, you are going to be healthier. We would love to hear from you. Subscribe to our YouTube channel. Questions, anything you'd like to know about, let us know. And have a truly great and healthful day.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.